Approximately 5 million Americans have an abdominal wall hernia. There are more than 600,000 groin and 400,000 abdominal wall hernias repaired annually. A hernia occurs when tissue bulges through an opening in the muscles of your abdomen or groin area. A hernia can be present at birth, develop over time, or occur at the site of an old incision. Who is at risk? Hernias most commonly occur in white men who are middle-aged or older, but they occur in women too. An abdominal wall injury, a chronic cough, or smoking can put you at greater risk.
How do you know if you have a hernia? Symptoms may include outward bulging of the skin, groin discomfort or tenderness, abdominal wall discomfort or swelling, pain in the abdomen, pelvis, or groin. The only way to know if your symptoms are caused by a hernia is to have a medical exam. We recommend having this evaluation with a general surgeon who can best advise you on how to proceed.
Hernias become larger over time. They can cause pain with lifting or with strenuous physical activity. Even when symptoms are minimal, consider any limitations the hernia puts on your time and activities. In rare cases, bowel trapped in a hernia can become stuck or incarcerated, or sometimes even strangulated, where blood flow to the affected area is cut off, and this requires emergency surgery. We want to do hernia repair surgery well before this would happen.
I was living with discomfort for about a year, and I went to my wellness checkup in December, and he told me I had a hernia. Well, I went to a seminar later on, around June, and they examined me and said that I need to get that done right away. So within 2 weeks, I went to Riverwood Healthcare. I had robotic surgery, and I went home the same day. And in 2 weeks, I was painting my deck. And I would recommend the robotic surgery to anyone in Riverwood Healthcare.
Hernia treatment options include watchful waiting, traditional open surgery, laparoscopic surgery, or robotic-assisted surgery. The treatment approach selected depends on the patient. We do more robotic-assisted hernia repairs because that's the best choice for our patients. With the Minnesota Institute for Minimally Invasive Surgery in Aitkin and Crosby, we've dedicated more than 25 years to performing and teaching surgeons minimally invasive techniques. Our team of 5 general surgeons uses an advanced robotic surgical system to repair these hernias.
The Da Vinci Xi system gives us a 3-dimensional view inside the body with an image that is magnified 10 times. The instruments are wristed, so we have more flexibility of movement during the surgical procedure. For a robotic-assisted hernia repair, we typically place the robotic instruments through 3 small incisions that are less than 1/2 inch long. Then we manipulate the instruments to close the hernia defect and cover it with mesh. The benefits of robotic-assisted surgery for hernia patients include less operative trauma, with only 3 tiny incisions, less pain, and less need for pain medication. The end result is that patients can return to work and the activities they enjoy much sooner than if they had an open procedure with larger incisions.
Many patients do not require any narcotic pain medication after robotic hernia surgery, and the majority of those that do are able to discontinue it within 3 days. Typically, hernia surgery patients get back to normal activity within a week. With robotic-assisted hernia repair, we encourage patients to be up and about the day of surgery and to quickly resume their normal activities. They follow up with us in 1 to 2 weeks after surgery.
I was out helping my husband cut some firewood, and I lifted a piece that was a little bit too big, and then I knew I had a hernia. The surgery went wonderful. I only had 3 small incisions. They were about like that big, and they're barely visible. 4 days after the robotic surgery, I was able to play with my grandkids and even lift them. I would definitely recommend Riverwood to have the robotic hernia repair surgery.
If you think you have a hernia, don't wait. Make an appointment with one of our hernia specialists today. Our team of hernia specialists includes Dr. Sean Roberts, Dr. Howard McAllister, Dr. Tim Lemire, Dr. Andrew Lovett, and Dr. Paul Severson. To make an appointment, call Riverwood at 218-927-5566.